afternoon everyone. So I'm Kavana, dietitian from Akka Hospital, and here the Dr. Praveen Ramachandra sir. So
I'm the physician and endocrinologist from Akka Hospital.
So today we'll be discussing about coronavirus. So I'll be asking few questions regarding coronavirus. So sir will be answering to it. So we'll continue. So sir, what is coronavirus basically?
Coronavirus is a viral infection. It is usually found in animals. So when human beings come across with animals, like what happened in China, in the live animal market, it got spread from animals to human beings.
Okay.
So once this virus gets transmitted to the human beings, then human beings to human beings spread will occur.
Okay.
Then that causes flu-like symptoms, pneumonia, renal failure, and
Okay.
this is how the coronavirus came into picture. And multiple coronaviruses are there. What we have now is novel 2019 coronavirus.
Okay.
It's a new type of coronavirus which has been identified.
Okay. So is it spreads through hair, sir?
Here, yeah. Like many of the respiratory tract viruses what we encounter, this virus spread through aerosols. Means when the patient who has a coronavirus infection, when he sneezes or cough, that time this makes small droplets. We call it as aerosols. When the patient coughs or sneezes, that spreads to another person who is sitting almost 3 feet distance to each other.
Okay.
It doesn't go beyond 3 feet. Only up to 3 feet it get transmitted. But not necessarily the infection should infected person when he coughs, the person should be in front. For example, one patient sitting here and he coughs in front of this table. Then the aerosols will be present in the table.
Okay.
And another person come after some time, he puts his hand on the table. Now the infection spread to his hand. Then he takes his hand near his mouth. Then he inhales.
Okay.
So even if the patient is not around, but the substance where he has coughed and is spread this infection, another person come later also it will get spread.
Okay.
So that also needs to be taken care.
Okay. Is there any other possibilities of spreading except through people?
People or animal or the substances. Like if somebody has used some handkerchiefs, the other person uses the same thing, then again it will spread.
Okay.
Like
Okay. What are the symptoms of it, sir?
See, majority of the coronavirus infections are not very serious. So majority will have like flu-like symptoms, meaning upper respiratory tract infection like sore throat, sneezing, running nose, like that. But 10% of these patients, they will develop some serious symptoms like pneumonia and renal failure, and there will be a respiratory failure will be there, oxygenation problem, and 10% of the patient can die due to this virus infection.
Okay.
It's
Is
pretty
it?
high rate of death actually, 10% of the infection.
Okay. So is it curable, sir, once it is affected?
Right now we don't have any medicine for that. And since the virus is new, there is no readily available vaccination also. But 90% of the cases, the patients where they have symptoms, this will recover with supportive management.
Okay. Okay.
So majority of them will have very mild kind of infection, they will recover.
Okay.
And only 10% will have the serious
Okay. But
consequences.
still now they have not found the vaccination.
No vaccination.
No vaccination. Okay. So how can we prevent this virus? How can we protect ourselves from this?
See, for example, if you are from the geographical area where right now it has been spread, any patients, any persons are coming from that area, they need to be kept quarantined up to 14 days. This virus may not show any symptom after infecting for 14 days. So we don't know whether you are infected or not infected. Or any patients who comes to your place or any person who is coming from that area is developing like flu-like symptoms, that person has to be quarantined, means he should not come into contact with other people. And if at all is going to hospital and all, they should wear a mask.
Okay.
So that it doesn't spread to others.
Okay. Okay. So how can we How can we treat that?
Treatment, as I told, is supportive. If they develop fever, we give anti-fever tablet. If they develop respiratory problem, difficulty in oxygenation, we give oxygenation like that. There is no definitive treatment, antiviral like, but we have supportive treatment. That is what it is.
Okay, okay. So what is the death rate, sir, till now?
The death rate is a bit higher than the SARS infection which we had earlier. It is almost 10%. Of the infected patient. That is a bit high.
So now in which countries we have seen this?
Mainly spread from mainland China. Then it is also reported in Kerala, 3 patients, and there are some symptomatology found in people who came from China to Delhi where they have been quarantined. So there is nothing to panic, but we should be prepared and we should follow something known as cough etiquette. If any patient are having any infections, he should ideally should not cough in front of another person.
Okay.
He should turn away and cough, and preferably he should use his elbow to cough, not his hand.
Okay.
If you put your elbow, you won't touch your hand with other subjects, and you don't transmit with your hand. So try to always use the elbow to cough, not the hand to cough. That has to be used, and it is possible you use tissue to cough, so the tissue can be disposable tissue can be disposed of, so that will not it will not continue further like transmission.
So is there any other things which you want to give regarding the coronavirus?
Coronavirus it may spread in India also, so we should be cautious. Whoever has symptoms of cough and other things should follow that cough etiquette which I told you. You can, whenever you go to hospital or other place meeting other people, he should use the mask. This is one of such mask actually. So these are the 2 sides. One is the blue side. Many times it is waterproof.
Okay.
And inside it will be a cotton side.
Okay.
That is absorbent.
Okay.
So when the patient applies like this, the top one he should there is a stick like thing is there. You have to apply like this and adjust here like and pull it till here. So whenever the patient coughs, he doesn't spread to others.
Okay.
That's the idea. And he has to dispose after use like.
Okay.
So side should be the bluish side should be outside. So the absorbent side should be inside. So that whenever he coughs, he doesn't go elsewhere and stays back.
Okay. So thank you, sir. Thank you for giving such a wonderful information for us. So thank you so much.
Thank you.